Hepatitis A epidemic hits San Diego. At least 16 people have died and more than 400 have been hospitalized following an outbreak of the deadly Hepatitis A virus in America's finest city. The Hepatitis A virus in San Diego is spread through contact with a fecally contaminated environment, or person to person. It attacks the liver and can be fatal. Roughly 2/3 of those infected are homeless and/or drug users. To combat the spread of the disease, city crews have begun power washing the streets with a bleach solution known to kill the virus. Officials have already set up hand washing stations in areas where the homeless congregate and deployed an additional 40 around the county. Free vaccinations are also available and recommended to anyone frequenting downtown. Hepatitis A vaccines work by prompting the body to produce antibodies against the disease. San Diego's precautionary efforts are modeled after those implemented in Los Angeles, where it proved effective. In addition to street spraying, installing hand-washing stations, and administering vaccines, city officials are also looking into providing more bathroom access downtown. Here are more contagious diseases you should watch out for. California chipmunks are carrying the plague. Visitors to California's Lake Tahoe are being warned to stay away from rodents after plague was detected in the area. Best known as the Black Death, which killed millions of Europeans in the 14th century, plague is still very much around in the United States today. California health officials say a flea taken from a chipmunk in the South Lake Tahoe area last month has tested positive for plague. Plague is naturally present in California. It is spread by rodents, including squirrels and chipmunks, and their fleas. Humans can contract the bacterial disease through close contact with an infected rodent or a flea bite. The disease can be fatal if not caught early and treated with antibiotics. Symptoms usually occur within 2 weeks of initial contact and include fever, nausea, weakness, and swollen lymph nodes. Plague is most commonly found in rural areas of the West, and an average of 7 human cases are reported each year. Warning signs have gone up near the Fallen Leaf Campground in South Lake Tahoe, where the plague-carrying flea was taken from. Visitors to the area are advised to cover up, wear insect repellent, and keep pets at home. 2 people were infected with plague in California last year after exposure to rodents in Yosemite Valley.
80 people in Texas monitored for signs of Ebola infection. Around 100 people are being monitored in Texas for potential exposure to Ebola. Liberian national Thomas Eric Duncan boarded the plane in Liberia's capital Monrovia and arrived in Dallas on September 20th. He is now receiving treatment for Ebola. People known to have been in contact with him are now being tested and monitored for a period of 3 weeks. Among those believed to be at risk are paramedics who took Duncan to the hospital, a handful of school children, and 4 family members. In the event that any of these people display symptoms, they will be quarantined, and people known to have been in contact with these new patients will be contacted. Authorities say that those contacted who present no symptoms after 21 days will no longer be monitored. However, in cases where the number of potential transmissions is unclear, health officials say they'll be unable to predict to where and to whom the virus might have spread. Duncan is the first person in the United States confirmed to have been infected with Ebola.
Dengue fever, anyone? FDA finds 327 more vials of contagious viruses in the same storage room they found smallpox last week. A week after 6 vials of smallpox viruses were found in the U.S.'s National Institutes of Health campus, FDA officials confirmed that more than 300 vials of assorted viruses have been discovered in the same storage room. According to reports, the viruses were likely placed there between 1946 and 1964, well before the NIH occupied the building in 1972. Oops, guess the new building manager never got the memo. The vials were found in the 3rd-floor storage room in Building 29A in the NIH campus. A total of 327 vials were found in 12 boxes containing dengue, influenza, Q fever, and rickettsia viruses. Investigators have destroyed 32 vials on the NIH facility, which contained samples of non-contagious specimens. 279 vials of assorted viruses were sent to Homeland Security's National Biodefense Analysis and Countermeasures Center in Fort Detrick, Maryland. And 16 unlabeled vials have been shipped to the Centers of Disease Control in Atlanta. Prior to the discovery of these vials, only 2 labs in the world, one at CDC and the other near Novosibirsk, Russia, were supposed to store smallpox samples. The FDA also confirmed that out of the 6 vials of smallpox virus discovered last week, at least 2 contained virus samples that were still alive. Meaning even though smallpox was eradicated in 1980, people exposed to the virus sample could potentially develop the debilitating disease. Authorities are now combing through FDA labs around the country to ensure that no other stray virus samples exist.
Spread of Legionnaires' disease in New York tied to contaminated cooling towers. New York City officials declared that they will be more vigilant about locating cooling towers throughout the city and making sure they are properly cleaned. This comes after an outbreak of Legionnaires' disease that has been traced to contaminated cooling towers. An outbreak of Legionnaires' disease that has made more than 80 people sick in New York since early July has been traced to at least 5 cooling towers in the South Bronx. The towers have tested positive for Legionella bacteria, which can sicken people who inhale water droplets released from contaminated towers. The incubation period for Legionnaires' disease is 10 days. Symptoms include fever, cough, chills, and muscle aches. All of those who died from the disease so far were all older adults with underlying medical conditions. All 5 towers that were found to be contaminated with the bacteria have been cleaned, and officials say they expect the rate of infection for the disease to taper off soon.
A highly contagious dog flu is making the rounds in the U.S. It's time to pay extra attention to your furry friends, as the highly contagious H3N2 dog flu is currently spreading in the U.S. Canine influenza, otherwise known as dog flu, is spread through coughing, barking, or sneezing. Kennels, bowls, and other objects can also spread the virus, as the virus remains viable for up to 48 hours on the surface of such objects. Dogs infected with the virus may not show symptoms until up to 4 days after infection. Isolation is the only way to contain the virus from spreading. The H3N2 dog flu was first recorded in Chicago in 2015. The most recent outbreaks were reported at 2 large dog shows in Georgia and Florida. Almost all dogs are susceptible to canine flu infection. There is only one approved vaccine that protects dogs from canine influenza A H3N8, but it is unknown whether it can also shield dogs against the H3N2 virus.